that when I was 20 years old, I'll start with just explaining what happened to me, where I was a junior at Virginia Tech and I was exploring my undergraduate career when I started having back pain. And only a few days later, I started having numbness and tingling in my toes, which eventually kind of traveled up my legs. And it was a very quick process, and ultimately, an MRI showed a tumor in my spine, which was pressing on my spinal cord and impeding my ability to walk. I had an emergency spinal surgery, which was a laminectomy to remove some of the bone in my back to take off the pressure. They removed the tumor, and ultimately that tumor went to the pathologist, who determined that it was Ewing sarcoma, which is a pediatric cancer, which just so happened to find its way to my spinal cord somehow. So with that said, I went through a long process of regaining the ability to walk, and I went through the entire journey of determining what the best treatment option was while recovering from surgery, of course. And it took me about 3 months to regain the ability to walk, and now I'm walking just fine, and I have all the feeling in my legs. And through that time, I went through 13 months of chemotherapy and 6 weeks of radiation. But with all of that said, I have always wanted to be a physician assistant, and being in the world of medicine, I, as a patient, and now on the other side of the world when it comes to medicine, I can really relate to my patients now that I am somehow have come to the Virginia Spine Institute and am now working directly with patients who have experienced and are currently experiencing things that I've gone through myself. So with that, I think I really would have loved to be a patient of Virginia Spine Institute at the time. It would have been wonderful having everything, whether it be physical therapy, regenerative medicine, neurologists, and spine surgeons, along with physician assistants and medical assistants, under one roof in order to allow that tertiary care facility to completely add to my care and make it that much easier for me as a patient, on top of everything else I was going through, to aid in my care and to my recovery. So with that said, I can understand that it can be scary, and of course my situation was very rare and a little bit of a unicorn, if you will. But with that said, don't be afraid, because here I am. I'm doing very well, and I've come out on top, and now I'm luckily I have the ability to give back to the community that changed my life.